Yeah, can you hear me okay? Sure. This is Andrew. All right. Well, I know that some of us are having some technical difficulties hearing the speakers, but I've been told to go ahead. So I presume that was an introduction. But either way, I am Andrew Lewandowski, and I'm a pediatrician. And as you can see, as soon as I get everything pulled up, we will be talking about this topic here, which is communicating about climate change with patients, but really anyone, because the same principles that we use to talk to people are the same principles that we would use to talk with anybody. So, thank you to Lori and the Montana Health Professionals for a Healthy Climate for having me. Before I get too far in, I do want to make sure to let people know that the land that I'm presenting from was previously occupied by the Kickapoo, Ho-Chunk, Peoria, Sauk, Sioux, and Miami tribes. And as we talk about things like communication, whether it's to policymakers or your best friend or your patients, that any kind of solutions or things that we are coming up with should incorporate the atrocities of the past so that we don't continue to make the same mistakes. And so, who am I? Well, I'm a community pediatrician, and I previously worked for a nonprofit HMO, and I have a history of seeing affluent privately insured patients, Medicaid patients. I've done refugee care, and currently I am an assistant professor with the University of Wisconsin, focusing on climate and health communication. I've also been a climate advocate, so there are a number of forms that I've performed advocacy if people want to touch base about that. And so, what I want to make sure that we discuss is you've learned about climate change and health, and so what are you going to do with that information? And I'm just going to go through a couple healthcare recommendations. The AMA Journal of Ethics has a whole issue on climate and health. And I'm going to read this quote, which is the health consequences of climate change are visible, often measurable, pose serious threats everywhere, and offer opportunities to significantly improve health everywhere. Embracing sustainability at the individual or organizational level thus helps to fulfill the professional obligation to protect health. And as a pediatrician, I go to the American Academy of Pediatrics, and their recommendation from their most recent revision of their policy statement in 2024 publishes six recommendations to pediatricians in the health sector. It also publishes six recommendations to government entities. And their number one recommendation is to incorporate climate change counseling into clinical practice. And so, I know this makes a lot of people feel uneasy. And so the question that a lot of people might ask is, well, do we really need to? Is this really the right avenue for this? And so the questions that I would pose back to that is does climate change affect health? Is the public misinformed about climate change and health? And is it our job to change public perception? And if the answers to these three questions are yes, then I would argue, yeah, it's absolutely our job to do this. And so I know that Dr. Byron spent a lot of time on the topic of climate change and health. There are many, many ways that climate change affects human health, but for the sake of time, we will skip this slide. But yes, it does affect health. Is the public misinformed? Well, this is the from the Yale Climate Opinion Maps. This is public perceptions in Montana in 2024. 68% of Montanans feel that global warming is happening. 53% of Montanans think that it's caused by human activities. 68% believe that global warming will harm future generations. 56 will harm people in the United States. 37% will harm me personally. After all, we are invincible individually. And then, of course, global warming is already harming people in the United States, 50%. And, despite seeing some degree of partisan divides up here, we can see support funding research into renewable energy sources is 74%, which to me is actually really remarkable that some of the main ways that we would mitigate climate change are supported by the vast majority of individuals, even though we see party line divides for similar topics. Now, over 99% of climate scientists would say that global warming is happening and caused by mostly human activities. And so when you look at the greater than 99% scientific consensus, or when you look at the assessment report from the most recent IPCC report, indicating that it's unequivocal that climate change is that humans are causing climate change and it's changing the planet. You can see there is quite a divide, and the public is misinformed about what's actually happening. And lastly, is it our role to change public perception? And I go back to the 1950s when we first published information saying that cigarettes were bad for health in 1958. And then the wave of information that kind of brushed over the American public since then. And of course, there are plenty of disinformation and misinformation campaigns that exist, but it doesn't mean that despite that misinformation and disinformation from the past, that we shouldn't as we gain information try to counsel patients that, oh, actually, you know what, smoking is bad for your health. Now, when it comes to climate change, though, what do people think? And I go back to this Eco America survey from 2021, where it says this right here, that the majority of Americans support climate change solutions that protect health. So, in this survey, they asked, would you support climate solutions if they benefited any of the following? Please select all that apply. And you can see here, 76% of respondents said that they would support climate solutions if they protected personal and public health, which was over good paying jobs and over, a number of other markers. And so I would say yes. So what did I do? Well, in 2019, I started to counsel my patients, and I wanted to create a spiel that I could have sort of memorized and measure responses to it. And so I followed the recommendations, and I started telling patients in my social history when I'm asking them about things in their home and environmental exposures. I also would say, in the last 2 years, the American Academy of Pediatrics and over 100 other health organizations declared climate change a health emergency. Air pollution alone caused over 64,000 premature deaths in the United States in 2016, and worsening air quality is only one out of 9 ways that climate change is harming people, disproportionately harming children. So, just like I want your children to eat healthy foods and be in the right car seat for their health and safety, we now know that decreasing our energy use, increasing efficiency, and supporting clean energy initiatives are also important for improving our children's health. Any questions? And then I would have discussions with my patients and families if they had questions about that. And then I wanted to know, was the 45 seconds worth it? And so I had a very small survey just of my patients. There were 234 patient families surveyed. There were 138 who responded. So it was an excellent response rate. And I wanted to know, as a result of those 45 seconds, did they learn more about climate change related health harms? Were they more likely to save energy, more likely to support clean energy initiatives? Did their political identity play a role? And then I also wanted to know what their actual reactions were. A lot of times with doctor surveys or any healthcare provider surveys, people will stay really quiet, but then when they get an anonymous survey, they will just blast you in the comments or they'll say that you're the greatest thing since sliced bread. And I really wanted to get that reaction from the patients who took the survey. And so we published that encounter. And knowledge about health harms of climate change, you can see here. I was actually really surprised, even when breaking down by liberal, moderate, conservative participants, that the percent responding yes, there were actually a good number of people saying that they already were aware of health harms from climate change, but learned more about climate change or health harms from climate change during the visit across the board. Almost 90% of participants said that they learned more about climate change and health just as a result of my counseling. Likelihood of changing energy use behaviors. So people said that they were, more likely to reduce energy use or improve energy efficiency across the board as a result of counseling. Across the board, again, likelihood of supporting clean energy initiatives. It was, positively correlated across all participants. This very unlikely or unlikely is always important to assess because you want to make sure that your counseling isn't causing people to go the other way, and then all of a sudden you don't support clean energy initiatives, and we can see those were zeros for the previous category and this one. And then the free response section, we were able to take the 96 free responses and divide it up into four themes. And I'm going to cover two themes for this presentation, which is, first of all, counseling effectiveness. We can see this comment, one respondent said, appreciate it. We've made changes since having our first child due to the information provided. I'm going to skip ahead to the next theme. So you can see these responses. It's good to know, change things in our home to make it healthier for our children. This person says that they're already doing a number of things for their home. This person says, I think it's important. And I really want to shed light on this category because what these comments had in common is that conservatives were the ones expressing these views. And so I really want to make sure that we're breaking down this mental block in our mind, this divide that being a conservative or a liberal or a progressive or a MAGA Republican or whoever, that has something to do with how people care about their health and climate change communication. And so it was great that it worked and they care about what I said, the majority of them. I do want to emphasize some problems with generalizing this approach, which is, first of all, it emphasizes mitigation. And if there's anything that the fossil fuel industry would like us to do, it's that they would like us to place the problem on the patient. We know that this is not, that climate change is not a problem that's going to be solved as soon as you on your own move off the grid and have your solar panels on your roof and never touch fossil fuels. We know that this is a systemic problem. Now, it doesn't mean you shouldn't have discussions with people in the public or in your healthcare workplace about mitigation practices. But I think the better thing to do is that we want to inform patients about climate change and their health. And so this formula about climate change vulnerability, which is your climate change harm, whether it's wildfire, smoke, flooding, Lyme disease, whatever it is, plus sensitivity, meaning how is that patient predisposed, whether it's chronic health conditions, whether it has to do with societal inequities that factor into how that patient is going to be harmed by this exposure. Those two added together increase your climate change vulnerability. And then adaptive capacity is how we can help. And so that's why it's exposure plus sensitivity minus adaptive capacity. And so what this might look like if you're counseling patients in your clinic or if you're talking to people would be something like, maybe you ask about if they have questions about climate change or the environment and their health. Maybe they say no. You see on their problem list that they have asthma or allergic rhinitis, or they have seizure disorders that are sensitive to not, getting poor sleep, which we know can be harmful from heat. Pick a topic and then say, well, I know that this is a newer topic for some people, but I want to make sure that when it comes to your child's asthma, that on some of these hotter days, when we know that the air quality is going to be a lot worse, that air quality index, when you're looking at it being above 50 or above 100, that we have to be really careful about making sure that Timmy is spending more time in filtered air because of that asthma. We know that with climate change, wildfire smoke and air quality is going to be a lot worse. And so that's something that I would expect us to want to pay closer attention to throughout the summer and for the summers to come. And then in the meantime, please let me know if you need any refills on your inhalers, if you want any ideas about how we can get better air filtration within your house. Let us know and we can discuss that. And that's a very simple, short way to take a climate change exposure, name climate change in your healthcare setting, name how it affects the sensitivity of that patient, and then maybe suggest a couple ways in which that you feel comfortable helping them. And one of the main components to this is even though we're focusing on this individual level when we talk to people or interpersonal and sorry, individual to interpersonal level, we know that from the social ecological model that there are ripple effects. Just like once upon a time you were talking to people about quitting smoking on their own, we know that now we have smoking bans in public places. And government policies that go into that. And so it's important to realize that if we all act as one large community, that collaboratively by changing the institution of medicine, that we should eventually see policy changes that are globally adopted. And who can counsel? It's not just doctors. And ultimately, and I really love how the AAP policy statement focuses on the fact that we have previously assumed that that with medicine, that we're practicing in a stable climate, that all of our diagnosis and all of our management is assuming that the climate is stable. And now that we can't make that assumption anymore, we really need to make sure that the way that our nurses do triage, the way that our doctors counsel patients, the way that our nutritionists give advice, really anyone who's certified to give advice, we should be looking at implementing ways that we can integrate climate change into what you do so that we can improve adaptive capacity and really going back to that vulnerability formula, improving healthcare overall. This is not about green teams. It's not about wellness committees. This is about what is good healthcare. And in the 21st century, where climate change is real and happening and affecting our patients, this is what good healthcare is. Now, everyone always wonders, what if I upset somebody? Well, I mean, ultimately, if you tie everything to caring for individuals, if you tie everything to health, then you're on the same page. It's not a partisan divide. And this is something that we deal with on a pretty regular basis as healthcare professionals as well, or even as individuals at the Thanksgiving table, where people can get upset about a topic. And, ultimately, as humans, we've got our feeling part of our brain and we have our thinking part of our brain. And it's very difficult for any of us to be in both of those spaces at once. And so, if you do upset somebody, whether it's about antibiotics or vaccines or gun safety measures or anything, first thing you want to do is not butt heads and say all of the facts and figures about why they're wrong and what they need to do. That's just going to make them more escalated, make them defensive. So de-escalate and say, "Oh my goodness, I'm really sorry that this is something that seems to have triggered you. Can you tell me more about what's making you upset?" And then listen to what your patients say, listen to what your family members say, listen to what your neighbors say. And then validate that. Say, oh, yeah, I can understand why that would be upsetting. Typically when people get upset, it's because of a value that's good. Maybe they're concerned about fairness. Maybe they're concerned about what they think is factual and they feel like you're being dishonest with them. Validate that value that they have. And then debrief after and say something to the effect of, I can understand that that's something that would make you really upset. And as your doctor, I really just care about you and your family and making sure that you can achieve and maintain health as best we can using the best scientific medical evidence that I can to help achieve those goals. And so, even though I know this is upsetting, the best information I have says that climate change is harming your health. And if that's a discussion you'd like to talk more about, let me know because I'm here to be that resource for you. And then fear of innovation. I'm going to just touch on this briefly in the interest of time, but I don't want people to worry about talking about climate change I feel like fear is something that keeps people from doing a number of things. I mean, how many times have you maybe spoken to somebody who took 4 semesters of a foreign language course in college, but yet then when they go to that foreign country that speaks that language, they're just like too petrified to say anything because they're worried they're going to make a mistake. Ultimately, we want to make sure that fear of criticism, uncertainty, negative impact on one's career, even though these are understandable fears, just know that we have communication models and behavior change models to support climate change communication. We have the strongest scientific evidence to support that climate change is harming us. And we have institutional support from pretty much every alphabet soup organization that exists in healthcare to say that we are communicating good information. And so, counseling pearls. So, number one, our job is to give professional healthcare recommendations, and politics shouldn't play a role in that. And people care about their health. Facts and statistics that you use, they should be used to elicit emotional responses, and they should be tailored to your patients. These 2 points kind of go hand in hand, right? If you're using a fact or figure that's irrelevant to a patient or a fact or figure that doesn't mean anything, even if it means something academically in some research paper, then you're not going to be influencing behavior change. You're just going to be communicating information. Likewise, we don't want any defensiveness, so no debating. We don't want to butt heads with anyone that we're talking to. We want to make sure we're having a productive conversation. Um, Furthermore, establish rapport first. We do this with lots of things, right? You don't go into a clinic visit or a hospital visit and immediately start talking to them about drug, sex, and rock and roll. You introduce yourself, you establish rapport, you do what you can to make sure that by the time you get to some of the more difficult discussions, that you have some trust established. And then practice. Let's say you try it once and you totally bomb. That's okay. That happens with a lot of things in medicine and in life. And so use your problem solving abilities to say, okay, well, what was the problem? And then as a result of that problem, what should my solution be the next time I bring this up? And what I really want to focus on here too is that climate counseling has not in any way jeopardized my relationship with my patients. And in fact, the worst comment in the free response section asking my patients, "Hey, what are your reactions to this climate change counseling?" It was not that he's some horrible fringe doctor and I can't believe you'd hired him and I'm never going to see him again. It was fine, but not necessary. That's the worst free response I got. And so recognize that it's your relationship with your patients that strengthens the importance of your counseling. It's your relationship with your neighbors, your community members, your family, that if we're not butting heads, if we're approaching it from a caring or health-oriented standpoint, that it's going to strengthen the message that we give to people. And then communication conclusions. I really want to emphasize the worst thing we can do is stay silent. There's no debate if there's no talk. And even if people aren't convinced by what you say, even if people think that you're full of baloney, at least they're talking about it. And at least it's something that maybe they're going to be so angry, they go home and they do their own Google research. It's in their head that it needs to be continually, discussed and talked about. Because if we stay silent, then there is no forward movement. Climate change and health can be discussed succinctly in healthcare settings. I did it in 45 seconds. Counseling about climate change and health can make a difference. Your title and your relationships with your patients are what make this work important. And then we need leaders on climate counseling in different healthcare settings across the country and arguably across the world in order to transform our system into climate-informed care to achieve those best practices. So thank you for your time. I know that was